Hello everyone, I'm Dr. Rhymes and Reasoning. I cleared the OET exam as a doctor, and in this video, I'll break it down for you in a very simple way. We'll go through each part of the exam, their timing, subparts, and some useful tips. At the end, I'll be giving you some tricks that I have used personally on my exam day. So let's get started. So, firstly, what is OET? OET is Occupational English Test. It's designed specifically for healthcare professionals like doctors, pharmacists, and others. It's accepted by GMC in the UK as well as Australia, New Zealand, Ireland, and several other countries. Unlike general English tests like IELTS, OET focuses on real life medical communication, the kind of English you'll actually use with patients and colleagues. So, the OET exam has four parts: listening, that's 40 minutes, reading, that's 60 minutes, writing, that's 45 minutes, and speaking, that's 20 minutes. So total exam is about 3.5 hours. So let's start with listening. The listening test is about 40 minutes long and it has three parts. Part A is about consultations. You listen to doctor-patient conversations and fill in the blanks. Part B has short workplace extracts like handovers or announcements, and you answer MCQs. Part C is long talks like lectures, and then you have to answer MCQs as well. All right. So, my tip for listening is don't try to write full sentences. You won't be able to do that. Focus on keywords and context. That's enough to get the right answer. Just listen, and whenever you think that it's relevant, then write it down. Okay? Don't overthink. It's the time of speed and accuracy both, right? Next is reading, which is 60 minutes in total. Part A is very fast paced, like 50 minutes only. You have to be very, very quick. You have four short texts and 20 questions. So it's all about skimming and scanning. Part B and C are done together. They're usually 45 minutes. Part B has short texts like hospital policies, guidelines, and then you have to attempt MCQs, right? Part C, they have longer academic articles where you need to understand meaning and inference, right? So, what's my tip? My tip is that part A is all about speed. So you have to read, okay? Skim and scan. You don't have to, go in details and spend so much time. You have to be very quick. And part B and C is more about accuracy. So you need to understand, and only then you'll be able to eliminate certain options and then to reach towards your right one. Okay. So writing is 45 minutes and you'll have just one task. For doctors, it's usually referral letter, discharge letter, or transfer letter. Don't worry, we'll be given case notes and you need to turn them into a clear professional letter. Remember, it's it's a test of your communication, right? It's not the test of your knowledge. They'll be giving you case notes, so don't worry about that. Start with purpose of the letter, okay? Then give main relevant details like history, findings, investigations, what has happened, when did it occur, and what are you expecting them to do. So end with your closing statement, what you're requesting or recommending. So tip for this section is don't include everything in notes. You have very limited space. So only what's the relevant to the task. What are they asking you to do, whether it is referral, discharge, or transfer letter? I know you have, like, you must have done plenty of these in your daily routine. Next is about speaking. It lasts around 20 minutes. So there's usually quick warm up in which they may ask you to introduce yourself It's not at all marked. You'll do two role plays after that. In each role play, you are the healthcare professional and the examiner plays the patient or relative. Okay? They test how well you explain things in simple terms, how you show empathy, how professional you sound. And they focus so much on your empathy. Like if a patient is angry, how are you able to calm them down? If they are very anxious, then you need to reassure them. Okay, I know that in our countries we are not used to these things, but they're really assessing these things on that day. They're not testing your medical knowledge. They'll be giving you some case notes that you can use to say certain, management. They're not testing you on that. Obviously, you can't be totally medically incorrect, but yeah, there are hints. You can use them. So they are mainly focusing on how well you are able to communicate, right? So my tip is use simple, patient-friendly language. Just as simple as that. Don't use medical jargon. So let's move towards scoring. Each subtest is scored from 0 to 500. Most councils require at least 350. So what should be your target? Your target should be to score more than 350, like grade B in each part. So we need to be consistent across all four sections. Okay. So as I promised, I'll be giving you some tips and tricks. So firstly, be confident. You're already a healthcare professional. You have, you have attempted so many harder exams than what this is. You just need to show them that yes, you can communicate well, you are able to understand them, and you're fit to work uh, in those conditions in hospitals abroad, right? So, firstly, practice under timed conditions. Use a stopwatch. It's very, very important. I can't stress enough. For writing, learn some standard letter phrases. It saves time. I'm not asking you to memorize answers. OET tests your skills, not your memory. Okay? You can't be incorrect. Like, you need to see what they're asking for, and you need to use only relevant case notes because you have only 2 pages to write the writing part. For speaking, record yourself, listen back for tone and clarity, and practice, practice, practice. You can use a mirror to practice. If possible, you can use a study partner to practice, your friends. Okay, but it is also important to practice with someone who can rectify your mistakes and help you to improve. Okay, so that's the OET explained in short. It is the real life communication you'll need as healthcare professional. With the right preparation, you can definitely succeed. If you found this